Now we're going to position for a clavicle. Clavicle is super simple. We just finished with a shoulder x-ray, so we sort of cheated in getting her in position. What we're going to do now is take the shoulder positioning, which you can see the collimation is open much wider than what you would need with a with a clavicle x-ray. So the inferior and inch medial central ray for the clavicle, for the shoulder is not true for the clavicle. So you'll feel for that bony prominence or that bony body of the clavicle, and you'll eye the central portion of that bone. Collimate down. Again, you don't want to put your marker in the anatomy itself, so you want it not in the soft tissues either. But you're going to collimate down just to the clavicle itself, but you still want to include the sternal joints as well, again all the way out to the soft tissues. Okay, your first view is straight. It's straight on. It's just an AP view of the clavicle itself. The hand can be in any position, it doesn't matter, because we're looking at the clavicle bone and not necessarily the humerus. Have the patient look away just so they don't tuck their chin, get exposure to their chin and face and things like that. It helps with your positioning as well. Once you're done with the AP, if you're doing the axial view, which is next, in an AP, then all you have to do is rotate your tube to a 15 degrees caudal, cephalic direction, so towards the head. Okay, and again, there are the angle monitors on the side of your portable, so you can understand what that looks like. So what that's going to do to the clavicle is actually straightens it out, and so we can see if anteriorly or posteriorly where is the bone displaced. Okay, and that's legitimately the only change. Arm stays the same, central ray stays the same. Her face, stays pointing away. You shouldn't have to move your marker much. You'll probably have to move it a little bit just because the projection has kind of pushed these tissues a little more superiorly, so you have to kind of move that out. But that is it. That's all it is to do an AP and an axial clavicle.